Within about a week, 10 days, I was off all my medication. So I'm Stephen Lasday. I'm a podiatrist at West Coast Podiatry Center in Sarasota and Bradenton, Florida. And we treat the entire range of the human foot, ankle, and leg, medically and surgically. I had ended up having back surgery. I had mild scoliosis as a child, and just degenerative disease, and I'm 50 and spending decades standing over patients, hunched over doing surgery. It's actually a syndrome, I guess. They call it health provider posture syndrome. I tried pretty much everything to avoid surgery: physical therapy, exercise, stretching, yoga, the whole shots, injections. And after about 7 months of doing everything but surgery, I finally decided to have a couple microdiscectomies at a couple levels where I had pretty profound herniations. And the surgery was wonderful. Surgery went fine, but because of the degeneration of my back, I was told it would could take up to 6 months or more for me to really recover. In the post-op period, I was given Percocet and I was given some muscle relaxers, which made me very sleepy and helped with the pain, but I would find myself back at work and I wasn't in pain, but I was very tired, so I would have to take several cups of coffee or down a 5-hour energy, and it felt very uncomfortable to me to be sleepy in the office, and tried to take something to be not sleepy. And about the same time, our state podiatry, or the national podiatry meeting actually was in Orlando, which I had scheduled to go up for long before my surgery, and I wasn't quite ready to go. And at that point, I was using a walker to walk long distances. And so here I was walking around this huge exhibit hall in this convention center hotel on a walker. And you stop at the various booths, and there was this booth, and they were selling the Quell unit. I had heard of the company. They've been around for decades, and they make instrumentation in the nerve health field, neurology. We actually have an older unit of theirs that's a unit we use to help diagnose diabetic neuropathy. It measures amplitude and velocity of nerve impulses. So I'm familiar with the company, and they had this unit called Quell, and so the gentleman there worked for the company, explained it to me, and he called his buddy over who was wearing a unit because he had a bad back, and it helped solve his problems. And so here I am, leaning over on a walker, looking at this, and I'm starting to salivate. So I said, at this point, So I rolled up my pant leg. The gentleman put a unit on, and whether it was psychosomatic, but at first I said I felt near, if not instant relief, within about a minute. I bought a unit, and the concept why they were there is we see a lot of patients between chronic pain, low back pain that radiates into the legs, diabetic neuropathic pain, and fibromyalgia. Those types of patients we see have a lot of pain in the lower extremities. So I figured I'd try it for my back. Long story short, within about a week, 10 days, I was off all my medication. For me, I truly think it helped me. And what I like about it, it's an FDA-approved product. It doesn't interact with any other medications. It's something that works pretty much by itself. You don't need anything else to work it. If you have a smartphone, there's some really cool apps where you can get some statistics. I can wear it during activity. I could wear it while I'm sitting. I could wear it while I'm sleeping. And it was just a very simple background type device that really got me back pain-free pretty quick. So this is the Quell unit. It's pretty self-contained. It's wearable pain relief, drug-free. It costs $250, which is, for a lot of people, the cost of 1 month's worth of neuropathy medication or pain medication.